At American Back Centers, you've got nothing to lose but the pain.
The following program, BackTalk, is sponsored by American Back Center.
At American Back Centers, you've got nothing to lose but the pain.
Welcome to BackTalk with Dr. Peter Pedduzi, located at 103 Bradford Road, Building 2, Suite 100 in Wexford. Now, with BackTalk, here is Dr. Peter Pedduzi.
Good morning, everyone. This is Dr. Peter Pedduzi with another episode of BackTalk. I'd like to start off each and every week. I'd like to say hello to our loyal listeners. Thank you for listening each and every week. And a special hello to anyone who is new to this radio show. This, again, is BackTalk with myself, Dr. Peter Pedduzi. We're on every Wednesday morning on KHB 620 AM from 9 to 10 in the morning. Of course, if you are new to the show, again, thank you for listening. And if you are new, typically in the first half hour or so of the show, we talk about the very unique and wide variety of treatment options we offer, all under one roof right here at the American Back Centers. Give you a brief history each and every week. Over 40 years ago, Dr. Dennis Miskovich started this practice, the American Back Centers. In the last over 10 years now, we moved down to our new location right across from what used to be Atria's. Now it's Ditka's restaurant, right here in the heart of Wexford, right off of Route 19, again across from Ditka's restaurant in the Stonewood Commons office complex, Building 2, Suite 100. Very centrally located. We have people coming from all over the tri-state area, Ohio, West Virginia, the state of New York, all over PA. We've had people from all over the country come to our office again. Again, we are one of the most experienced facilities in the country now instituting this type of care. We've been doing it, of course, for a long time, starting with Dr. Dennis Miskovich, starting the practice over 40 years ago. And in the last 20 years, in 1994 to be exact, Dr. Miskovich saw the groundbreaking research that was done by Drs. Ramos and Martin, two neurosurgeons, and published in the Journal of Neurosurgery on VAC-C therapy, showing for the first time and still to date, and this is why VAC-C is the only non-invasive, non-surgical device out there, medical device out there, that actually has been proven to create negative pressure, form that vacuum, work on that patented logarithmic time curve, pulling the muscles so they don't spasm, they don't contract. That's what you see with traction with these decompression devices. It actually increases the interdiscal pressure, the pressure within the disc, as opposed to VAC-C actually reduces the pressure within your disc space, creating that vacuum of negative pressure, sucking, pulling that disc material, that fluid, the nutrients, back into that compressed, degenerative disc, desiccated disc, pulling that herniated disc material, extruded disc material, bulging disc material, back off the nerve, relieving your sciatic pain, relieving your spinal stenosis. If that disc is narrowing that canal, contributing to your spinal stenosis, relieving your pain, your numbness, your weakness, your foot drop in many cases, attributed to a disc pushing on the nerve, causing foot weakness and dorsiflexion, causing that foot drop. We've seen many, many great success stories over the years. We've seen thousands of patients, without exaggeration, over the last 20 years. We have a documented over 92% success rate with our patients because of our expertise and our many years of treating these type of, in many cases, very difficult cases that people have been to every doctor known to man. In some cases, you come in for your consultation, you sit down with us, we go over your history, physical exam, look at your films if you have any. If you have an X-ray, MRI, CT, make sure you bring it in, and then determine if you're a candidate for this therapy called VAC-C. And it all started way back in 1994. We're one of the first facilities in the country to institute this type of care, because he purchased not one but two tables way back in 94 when he saw this research come out. He saw that even the inventor of the VAC-C, Dr. Dyer was a former Surgeon General of Ontario, Canada, and he himself was a medical doctor. He also had a PhD as well to his credentials. He saw the lack of success they had even with back surgery back then. Developed the machine back in approximately 1989, put it on the market in the early 90s, and that research came out in 94, showing, again, still to date, and it still has not been replicated by any other so-called device. VAC-C is patented. It is a patented procedure in how it works. And VAC-C is still the only device that has been proven to do this, and it has the approval by the FDA. In the second half hour of the show, we typically talk about a nutrition or fitness-related topic. Last week we touched on falling is taking a toll on elderly brains. So we'll finish that up today. We didn't have time to get through the entire article. We'll kind of summarize it and finish it up. But this week, what does sugar do on your brain? So we're talking a lot about the brain. You're seeing a lot of issues with Sidney Crosby, and, of course, we got a big game tonight, Game 7, so I'm sure most of you will be watching that on the edge of your seats, hoping the Pens win. But these concussions are a real problem, and we talked about how falling in the elderly population is causing concussions, causing brain injuries. Not most people think, well, you fall, you break a hip, you break a bone per se. Yes, that is an issue, but even more so, the issues with brain injuries with falling. We touched on that. We'll summarize that again this week in talking about how sugar, what does sugar do to your brain, and eating too much sugar. A lot of us, not myself included, do eat too much sugar, too many sweets. And yes, it can affect your brain as well. So we'll touch on that in the nutrition section today. Definitely stay tuned for that. And remember, if you listen to the show, if you are new to the show, we typically post all of the articles, health articles, on our Facebook page. So number one, you can go to where the source is. If the source is coming from, today the source is Mercola.com. A lot of times we get information from his site, MERCOLA.com. Go to his website, look for the title, What Does Sugar Do to Your Brain, and just print that off. If you don't have a printer, you don't have the internet, you don't have a computer, we'll be more than happy to send those articles out to you free of charge. Just call our office, give us your name and address, and we'll send it out to you free of charge. We ask, again, only if you don't have that equipment, because we can't be sending it out to everybody that listens to the show. But if you don't have that, we definitely will send it out to you. Also, visiting our Facebook page is probably the easiest way of doing it. Just go to American Back Centers Pittsburgh. If you have a second, like our Facebook page. You can request us to be your friend as well on the page as well, a friend request, like our page, and then print off the information that you want. There's the past BackTalk health articles on there as well, so you can scroll down there and look at all the things we've talked about since we've been putting them on the Facebook page. And, of course, we've been on the radio for over 12 years now, but we just started doing it this past year, putting the articles on there. And, of course, today's article and last week's and the last year or so should be on there, so you can take a look at those, print off what you want. Always look ahead. You can read along with us as we go along if you'd like that as well. Again, American Back Centers Pittsburgh. Like our page, print off what you'd like, including today's health article again. What does sugar do to your brain? Okay, of course, the American Back Centers, as we talk about each and every week, we are not your typical chiropractic office. As we mentioned, since 1994, the American Back Centers has been known as the area's disc specialty center. We've specialized in these very difficult cases, including herniated disc, bulging disc, failed back surgery, sciatica, stenosis, and degenerative disc disease. Whether a patient's coming in with foot drop, I also failed to mention, if you watched the Channel 11 video when Channel 11 did our report on our office, and we can send it to you free of charge, just call us and we can send you out the video. Dr. Miskovich talks about how the rings that contain the fluid of the disc, the nucleus pulposus, the rings, the annulus fibrosus, those tough rings can sometimes be torn. And you may be told on an MRI from the doctor you're seeing that you have a torn disc. What's happening is those rings are really tough to tear, and if they do tear, the fluid will start to leak out, and that can be a problem. Luckily, though, with VaxD, unlike these other decompression traction devices, VaxD's been proven to actually strengthen those rings. Dr. Miskovich talks about with the isometric contraction that you undergo with VaxD, those rings, very much like shoestrings on your shoes, will tighten up and get stronger. So yes, if you have a torn disc, we can also possibly help you too with VaxD therapy, strengthening those rings and making them stronger. So again, VaxD is truly a revolutionary treatment that has a proven track record. We all know this over 20 years now. We've been helping people with VaxD. Very safe treatment. Cost-effective treatment. If there is any out-of-pocket expense, deductible, co-pay, any out-of-pocket expense, we will tell you. When you come in for the consultation, it's a free consult. And we tell you, you give your insurance card to my office manager. She verifies everything before you even go back to see the doctor. And all that's verified, so you know exactly what you'll be paying, if anything, out of pocket before you go back and see the doctor, even though it's a free consultation. So, in addition, the vaccine, as we mentioned, is used in over 300 facilities worldwide now, hospitals. There's a few medical clinics, orthopedic surgeons in private practice, chiropractic facilities, as well as physical therapy facilities using this. There's approximately 3,000 patients a day currently being treated with vaccine therapy. So as we ask you each and every day on this show, if you're out there listening, if you yourself, you know someone who's suffering with these type of problems, whether it's severe back pain, even neck pain, which we'll touch on here in a few moments, the disc treatments for the neck that we offer here, unresponsive to your current treatment, you want to avoid further pain medication, epidurals, pain shots, physical therapy not working for you. We talk about that. We do therapy here at our office, but as I always mention, there's a time and a place for it. And in many cases, when you have a hot disc that's inflamed, that's not responding to conventional therapy, you need something specific to the disc. And this treatment is specifically FDA approved for disc problems. If you've been told you need surgery, you want a second opinion first, which you should. The surgery has a very low success rate. Surgery is a permanent procedure with possible permanent complications. You've already had a surgery. You've been told you need a second, third, fourth surgery even. Again, with each surgical procedure, as we harp on each and every week on this show, the success rate goes down with each subsequent procedure, and the rate of possible permanent complication goes up with each subsequent surgical procedure. So as we ask each and every week, why would you even consider this with all its complications when something as safe and effective as vaccine is available? If your symptoms are radiating in your hips, your buttocks, your groin, down your leg, numbness and tingling, weakness, foot drop, those are very common presentations that we see here at the American Back Centers, and we may be able to help you. And again, the only way you're going to know is by coming in for a free consultation. We'll tell you how you can do that here in a few moments. So we are, again, doctors dedicated to bring you long-term relief and avoiding the need for surgery now as well as into the future. Don't wait until your condition worsens. Call us today. Our toll-free number is 1-888-222-8293. Again, 1-888, not 1-800-222-8293, or 724-935-3300. You can also visit our website and actually request an appointment right on the web page. The website is www.americanbackcenters.com. Again, www.americanbackcenters.com. And you can request an appointment right on the website. You can also subscribe to our newsletter. It's a free daily email newsletter featuring information on various new health topics such as VaxD, as well as many other health issues. There's a quote for the day on there as well, inspirational quotes. So it's not all about the vaccine. It's mainly about different health issues, mental health, physical health, chiropractic, nutrition, all in a daily email. So it's really nice. You can wake up, you get a quote for the day on there each and every day. If you don't have time to look at it, just delete it or don't even look at it. The next day you'll get new health tips and inspirational quotes free of charge sent to your email. And then monthly, you automatically get signed up for a monthly In Good Hands newsletter, it's called. And this is great because some of the greatest minds in the country contribute to this. Some of the people have been on Dr. Oz, some of the chief medical directors of the Cleveland Clinic, and just a great once-a-month newsletter. And it's about maybe 10 pages or so. And when you automatically sign up for the daily Health Update newsletter, you get signed up for the monthly In Good Hands newsletter. So go to our webpage, www.americanback, B-A-C-K, B as in boy, A-C-K, centers, plural.com, and subscribe to that today. And you'll get that monthly newsletter free of charge again as well. Also, you can visit our blog on the webpage as well, learn about news and advancements in disc, back, and joint therapy that continually updated on our blog, and some other information about our office. Of course, you can learn more about VaxD going to our webpage, some of the other services we offer, which we're going to touch on here in a few moments. Meet the doctors and staff. Some great, many patient testimonials on our treatments here. A section on VAXD versus other spinal therapies, some of these so-called traction decompression devices as well. We'll kind of explain the differences there as well if you're not sure about that. Again, visit our webpage, www.americanbackcenters.com, or you can call us, again, toll-free to schedule your consultation, 1-888-222-8293 or 724-935-3300. Also, finally, I always give you out the fax number. We do encourage you, especially if you're coming from a great distance. We have people coming from many hours away to come see us. The fax number is 724-935-3321. That's the fax number, 3321. If you'd like to fax over any reports, MRI, X-ray reports, CT reports, you can have faxed over. And we encourage you to do this, again, because we can take a look at it. Just put your phone number, name. Your name should be on there, but at least your phone number on there so we can call you back and discuss it with you, especially if you're coming from a great distance. We can possibly save you a trip out here if there's something obvious on there that we feel we cannot help you with. All right, in addition to the VAXD, of course, the VAXD is a FDA-approved medical procedure for disc problems. We've been doing it here for over 20 years now. Very safe procedure. We also offer cervical disc treatment options if you have a disc problem, degenerative disc disease, bulging disc, herniated disc, even failed neck surgery. You've been told you need neck surgery and you want to avoid this. Come and talk to us first. We offer the best state-of-the-art cervical disc treatments here at the American Back Centers. We also offer therapy and rehab. We talked about therapy, state-of-the-art facilities, individualized programs for your problem, whether it's neck, back, shoulder, knee, ankle. We treat all those issues, looking at your ergonomics, what you're doing at work, what you're doing at home, postural instruction, looking at the total picture. We have people coming in all the time with scripts for therapy from their PCPs, and they choose to do it here because they know we have more. We have all what they have, but we also have the chiropractic, we have the massage, and the specialized disc treatments if they have those type of problems. Again, the only way you know if you have those type of problems is coming in. We can diagnose you. Again, we're a disc specialty center, so we are trained specifically, and we have many years of experience to determine if, in fact, you have these more difficult cases. And if you have simple cases, we can help you as well, but we have the best treatment options for these most difficult cases. Wrist, hand, finger, foot, ankle, and knee problems, examples including tendonitis, rotator cuff, carpal tunnel, frozen shoulder, and more. Deep tissue massage, done by licensed massage therapists, myofascial trigger point therapy, acupressure reflexology, comprehensive nutritional consultations through standard process, symptom survey. We can send them out to you. We can pick it up and do it right here at our office. We score it, and we get it back to you and give you a comprehensive nutritional profile. Custom-made orthotics, computerized digital scanning, assessing for foot dysfunction. Truly great. We have patients do these all the time. They are wonderful. I'm actually getting in a brand-new scanner here soon. It's a 3D scanner, and a little bit quicker. It works a little bit better with Windows 10. I don't know if any of you have upgraded to Windows 10. There's many nightmares there. A lot of people want to go back to Windows 7, Windows XP. A lot of compatibility issues, but we're getting a new high-tech scanner. The scanner we had in here was high-tech, but it's more compatible now with Windows 10, so we'll have less lag, and we'll be able to get your scan out even quicker so you don't have to wait as long. But again, it's a truly custom-made scan, a custom scan of your foot. If you do have a problem, we send it off to the company. They make you a custom orthotic. A lot of times that's the last 5 to 10% of the problem. Remember, it starts from the ground up. And if you have a problem in those arches, plantar fasciitis, heel spur, bunions, those issues can be assessed and addressed, I should say, with these orthotics. In many cases, that takes away that last little bit of the pain that we've been not being able to get in some cases when we've been treating your back, your neck, whatever it may be. And again, sometimes that's the case. And again, starting from the ground up, that you can see how the feet can definitely affect the knees, the hip, the back. They have a lot of people come in. They're having wear and tear on their hips, their knees. They're wondering why. You know, they're being treated for their knee, their hip. They're doing the rehab. They're doing the therapy. They're getting adjusted. So why is their hip still wearing down? Why is their knee still wearing down? And then we look at those feet, and those arches are gone. It's putting tremendous stress on their knee, their hip. We give them the custom-made orthotics, not something from a shelf in the back, something that's truly custom to their individual problems, and it truly makes a huge difference. If you'd like to try and see if the custom-made orthotics are right for you, and if you'd like to try a free 3D digital scan of your foot, just call our office. We can get you set up for that. Again, toll-free 1-888-222-8293 or 724-935-3300. We also have in-house X-ray, nerve conduction testing, ultrasound testing if you need those type of things. We also have a very convenient MRI CT facility right across the street from our office. If you need those type of imaging, we can write you a prescription, and you can literally go right across the street and receive it. And finally, I'm a certified personal trainer as well, so we can help you get back in the gym and do things correctly without injuring yourself. And again, doing things correctly is so, so important because people have good intentions, but in many cases end up hurting themselves as they try to get healthy. As we talk about each and every week, our protocol is unique. No one does it like we do here at the American Back Centers. Our success rate is slightly higher than the national average. Some of the other more experienced back facilities are this high as well because, again, they have the experience. Our success rate is over 92% if accepted for care. Our protocol is physician-directed. Our protocol engages other modalities as needed on a case-by-case basis. We have over 20 years of experience, one of the most experienced facilities in the country. And, of course, we screen out and decline candidates whose medical records and evaluation indicate we are unlikely to help them. So if we cannot help you, of course, we will tell you. The VAC table and its computer work with each individual patient, adjusting back tension, which in turn adjusts interdiscal pressure, with pressure within the disc, moment by moment. The computer adjusts the tension in small amounts so that the muscles in the lower back do not spasm or contract during treatment, which allows for true separation and decompression to take place. So again, if you'd like to schedule, we've talked about this each and every week on the show, a free consultation at no cost or obligation. Again, call the toll-free number we just gave you. We'll sit down and go over your problem in detail, answering all your questions. We do encourage you, if you can, bring somebody in with you when you come in for your consultation. Number one, it's always helpful to have somebody drive you out here, especially if you're in pain, and that make sure you're asking all the right questions. You may get home and forget something. It's always helpful to have family member, friend, neighbor, whomever come in with you when you come in for your consultation. It's not essential, but it makes sense. So, again, we do a detailed history, physical exam, neurological exam if necessary. We encourage you, bring in your x-rays, bring in your CT, MRI films. We go over all this with you. If we do feel you need more, we can do the x-rays in the office. We can send you right across the street to receive the MRI, CT scan. If you have a pacemaker, you may need to get a CT or a metal in your body. Either way, we can do that, and that's all part of the consultation. We also offer a free video and 24-page color booklet. The video is when Channel 11 WPXI did a medical breakthroughs report. This was broadcasted on Channel 11 News, the American Back Centers. All the success, they saw all the people we were helping. They decided to put us on Channel 11 News. This is on a free DVD. It's a great way for you to see vaccine operation, answering some of the key questions you may have. Also, the 24-page color booklet really shows you all the ins and outs of VAC-C, answering warrior questions, and showing you all the research that's been done on this great treatment called VAC-C and why it's different and much more effective than the so-called decompression traction devices. Also, we have some research papers. The first paper we're very proud of, as I talk about each and every week. This paper is published in the Canadian Journal of Clinical Medicine. This research was done right here at our office, actually the old office down the street, but right here at the American Back Centers, and published in the Canadian Journal of Clinical Medicine. Also, the Knife in the Back article showing the failures of back surgery, specifically fusion surgery, and why surgery is not the best approach for chronic back pain. Finally, we have the blue workers' comp and the yellow auto accident booklets, great resources if you're hurt at work. We talk about this each and every week. So many people are taken advantage of when they get hurt at work. They don't know their rights. I give this book, this blue book, to every workers' comp patient that comes into our office. Number one, we have the best treatments for people injured at work. Many people lift something or overexert something, their body at work. They're told that they just have a strain, sprain, but in many cases, if the pain's going your butt, down your legs, you may have a disc problem. Of course, we can help you with the sprain, strain, but we have the specialized treatments for the disc problems. The only way you're going to know if you have a disc problem is by coming in. In many cases, we examine you, of course, and what I was getting at is many cases we order an MRI, and we see conclusively that you have a disc problem, and then that diagnosis comes about. In many cases, these workers' comp doctors, these panel doctors they send you to, initially, their only goal is to get you back to work as soon as possible, even if you're still in pain. And they're going to downgrade what you actually have in many cases. Even if they have an inkling you may have a disc problem, they're going to slap on sprain, strain, because that tells the insurance company less treatment and getting you back to work sooner. And that's what it's all about. So if you have a workers' comp injury, of course, call and get the blue workers' comp book. It's free. Just call our office. Call our office and schedule a consultation and see if we can help you. The yellow book, remember, is for auto accidents. We have a lot of great therapy and treatments for whiplash cases, auto accidents, personal injury cases as well. Remember, call and get the yellow booklet. It's free, showing your rights as an injured auto accident person, as well as workers' comp, work-related injury, so you're not taken advantage of. In many cases, you don't even know. The insurance companies, the employer, tells you blatant lies about what you can and cannot do. Many people don't know their rights, and it's very unfortunate. So please, 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 please get these booklets so you're not taken advantage of. All right, I'm going to give you a quick testimonial. This is from a head football coach of William Penn College who received VAXD therapy. He goes on to say, I wanted to take the time to thank all of you for educating me on what I now consider to be one of the most sensible and cost-effective ways to treat a herniated or ruptured disc. My son Chris suffered for about a year with a severe herniation at L4, L5 in the lower back. This condition was a result of an attempt to lift a DOT platform out of the water. After approximately a year of suffering with the pain and severe loss of flexibility, he found himself in a position of having to give up something he really enjoyed, playing college football. Being a concerned father and coach, we visited a respected sports injury clinic. And after an MRI report confirmed the problem, we were basically given two options. The first was back surgery. And the second was a more conservative approach, which involved physical therapy and basically not doing any physical activity, which would irritate the ruptured disc. After giving this some serious thought, I came to the conclusion that neither of these two options were acceptable. I really did not feel that the percentage rate for a full recovery was very good at all with either physical therapy or surgery. After hearing and reading about VAXD therapy, I decided it was worth a try. I know both Chris and myself are very happy we decided to go with VAXD. We finished therapy, and Chris had a follow-up treatment, and at the time was experiencing his full flexibility level with no discomfort at all. He was able to play his senior football season in the fall without any problems, which made him very happy. It was somewhat ironic that I had an incoming freshman this past fall come in with the same condition. So we decided to use the VAXD clinic over the Christmas holiday break. So far, he's experiencing the same positive results as Chris did, and I would strongly recommend the VAXD therapy for any person looking for a bona fide and cost-effective treatment for low back pain. Thank you for a successful and rewarding experience. Again, this is a head football coach, William Penn College. His son, and then freshman coming in had the same problem, both receiving VAXD, able to avoid surgery. And, of course, at a very young age, why would you even consider surgery? And we talk about how physical therapy does not really address the actual disc itself. In many cases, in mild cases, it may help with the strengthening of the muscles, which will help the condition resolve itself. But if the condition is more severe, in many cases, just allow the condition to progress and get worse and actually irritated by the excessive movement, which is something we don't want. We do therapy here at the office, but as I always mention, there's a time and a place for therapy. And in many cases, when you have a more severe case, the therapy can actually just make things worse. So again, VAXD is used to treat these difficult cases, designed to relieve pressure on the structures that may be causing your back pain associated with bulging, herniated disc, degenerative disc disease, as well as the most difficult disc-related cases leading to foot drop, sciatic, as we mentioned, muscle weakness. These conditions, again, are patients that have gone to every doctor known to man in many cases, and they come to us hoping that we can help them. When we talk about logarithmic curve, and this is unique to VAXD. VAXD used this patented technology to actually work on a logarithmic curve to allow the back muscles to relax and disc pressure to be lowered. This is very important. VAXD actually fools the muscle proprioceptors, avoiding muscle contraction. Unlike traction therapies, that's the problem with traction and spinal decompression. They're not able to do this. And VAXD, with their patented procedure using this logarithmic curve, fools the muscle proprioceptors in avoiding muscle contraction. So you're actually getting that negative pressure, that vacuum effect. And that's, again, what makes VAXD unique. We talk about the medical textbooks, practice of minimally invasive spinal technique published by the College of Physicians Publishing Division, the medical textbook used in medical schools. Chapter 35 of the text focuses exclusively on VAXD. The summary concludes that VAXD should not be considered traction in the traditional sense, but as decompression. VAXD is the only non-invasive treatment that has been proven to decompress the disc, and this is very important. With other traction devices, there's only been indirect proof. Only with VAXD, there's direct proof that it's actually doing what it says it does. So don't be fooled by these other people. We have these people all the time coming to us with these expensive therapy programs. I've seen facilities charge upwards of $8,000 to $10,000 for these treatment plans with no backing, no published credibility that they actually do anything that VAXD does. And I've even seen recently now some of these facilities are actually reducing their price and trying to entice people to come into their therapies to, again, entice them to come in, even though if you actually look at the research and documentation, you'll see that VAXD is unique and effective. And again, why would you spend thousands of dollars on these unpublished, uncredible procedures that are just glorified traction devices? Leading physicians in orthopedic medicine, pain medicine, neurology, and other specialties in hundreds of clinics worldwide utilize VAXD's patented technology. Many doctors choose VAXD over other devices because it employs the original patented technology from which non-surgical spinal decompression was born. And that's very, very important to note. Of course, we know Dr. Alan Dyer, who's the former Deputy Minister of Ontario, Canada, invented the VAXD. He also played a part in inventing the heart defibrillator as well, which we all know is a very, very important invention. The research just goes on and on. There's research published in the Archives of Physical Medicine and Rehab on VAXD, Journal of Orthopedic and Sports Physical Therapy, Journal of Neurological Research, Journal of Neurosurgery, as we mentioned, over and over and over, Canadian Journal of Clinical Medicine, Anesthesiology, News, many, many research studies. Independence Blue Cross Blue Shield has done research on VAXD, proving it to be close to 90% effective. This is an independent insurance company doing research on VAXD. We talked about the practice of minimally invasive spinal technique, a medical textbook showing and proving that VAXD is unlike any of these other so-called decompression traction devices. So much peer-reviewed research has been done and currently being done on VAXD therapy. So again, VAXD, again, you have to make sure you know this as well. VAXD is not a temporary fix. It's a permanent solution. Results of this medical treatment, along with rehab, result in a permanent result, addressing the structural cause of the problem, not just the symptoms. So contrary to what you may think, VAXD is not a temporary fix. It is a permanent solution. We have research studies showing a 4-year outcome study, patients still pain-free 4+ years after VAXD therapy. This was published in the Journal of Anesthesiology News by a medical doctor, showing again that the results of VAXD are indeed permanent. So the real question should be, again, why would you even think about surgery with all its possible complications and lack of success, not including the normal risks, including infection, bleeding, blood clots when Vaxi is an option. Remember, Vaxi is a non-invasive treatment, a very safe treatment with a much, much higher success rate than surgery, pain injections, physical therapy. Many patients go this route and eventually end up at our office wishing they would have come to us much sooner. Remember, Vaxi addresses structural cause, not just the symptoms. Truly, decompressing the disc, restoring the fluid content, taking the compression off the spine and the disc, relieving your pain associated with low back pain, disc problems, herniated, degenerated, extruded, sciatica, stenosis, foot drop, numbness and tingling, weakness, and even failed back surgery cases. Very, very important to note. Many people think just because they have failed back surgery, they're not a candidate for Vaxi. In some cases, even fusion surgeries, if you just have one level involvement, we may be able to help you as well. With those areas above and below, we talk about how fusion surgeries take care of the compression. But now you have fixed hardware, which is very invasive. Number one there, you have a fixed cage. That cage does not move now. That segment used to move, now it can't move. So that's a problem. It's kind of like taking a link out of a chain, the areas above and below. Something has to compensate for that lack of movement, so the areas above and below. And if you already have, and most people that come in with back problems, when they get a surgery, they get the discectomy, they snip off a piece of the disc. We all know whether it's through a laser, tremendous out-of-pocket expense with these laser spinal surgery, $20,000 to $40,000 out of pocket. Virtually the same thing as the scalpel, but you're paying $20,000 for a laser to do it. The compression is not being addressed, so the arthritis, the bone spurs still continue to occur. Then they go in there and fuse the segment to take care of the compression. They typically don't do the fusion first because it's very, very invasive, rods and screws. We all know what we just said. The problem with the fusion is it does take care of the compression, but now it's not moving, and the areas above and below have to compensate. But 9 times out of 10, most people have more than one level of involvement, so when they fuse one segment, those segments that are already suffering, already bulging, already compressing, now they start to compress more because now they have to compensate more for a fixed segment. So guess what? 9 times out of 10, if not 99 times out of 100, they have to go in for another surgery, another fusion, and so on. So if you're in that predicament, before you get another fusion, before you get another surgery, come in and talk with us. Even if you have one fusion, we may be able to help those areas above and below with Vaxi therapy. All right, before we get into our nutrition fitness segment today, what does sugar do for your brain? And we're going to summarize last week's as well. We're going to highlight some key supplements, which we do from time to time. We have a new product called Natural Calm. We've always had the Natural Calm. It's a great magnesium supplement in a powdered form, organic, only sweetened with stevia, very, very natural, no artificial coloring or flavorings at all. Great magnesium supplement, especially if you're supplementing with calcium, vitamin D. We talk about the importance of magnesium as well to keep everything in balance, as well as for muscle spasm, restless leg, stress, etc. But they have a new product called Natural Calm with Calmful Sleep. So you have the ingredients that are in the Natural Calm, the magnesium, but you also have the helping some supplements that help with sleep as well. So you have your GABA, your L-theanine, as well as melatonin, all in one product. Again, only sweetened with stevia, all organic, gluten-free, GMO-free, no dairy, egg, soy, wheat, sugar, fructose, starch, preservatives, artificial colors or flavors at all. And again, this is a calm combining the sleep supplements as well, GABA and melatonin. So again, you can try this. You can pick it up at our office. It's brand new. Pick it up at the office, and we can send it to you for a small shipping fee if you're having trouble sleeping. You want a magnesium supplement with the melatonin and the GABA, all in one, in a powdered form. You can put it right in your tea at night in a hot liquid. Great way to go to sleep at night, right before bed. You can try it. Just call our office, and we can send it to you. You can pick it up right here at the American Back Center. We also have the product I rave about, touched on the last couple of weeks, for carpal tunnel. It has the active form of B6, B1, and zinc all together. B6, B1 plus zinc is the product. You can pick it up. Very great, very successful, I should say, for carpal tunnel, as well as other peripheral neuropathy issues, but specifically carpal tunnel. We've had great successes with this. We also, of course, have rehab therapy, exercises, different things that we do nutritionally and diet for carpal tunnel as well. Of course, chiropractic and massage, addressing and relieving the nerve interference and compression. But this is a great supplement. If you'd like to try it, we can ship it to you. You can pick it up right here. B6, B1 plus zinc. Very, very effective for carpal tunnel. And finally, the Garlic Plus. Wonderful supplement for viruses and helping with the virus season. The viruses are always around, whether it's the flu or any virus. It combines vitamin C with garlic as well as other natural products for a great way to help avoid and treat, in many cases, viruses. And ever since I've been taking it, I've not had a cold since, any type of virus. I have 2 little kids, a 3-year-old and a 1-year-old. Occasionally they'll pick something up from time to time from being around other little kids. And I have not got anything ever since I've been on the Garlic Plus, so I can personally stand behind this product. I know it works, and I've seen it with my patients as well as myself. And it's a wonderful product if you'd like to try Garlic Plus. Also with a high-quality probiotic, I think it really gives you a great immune barrier against these viruses and other bugs that are out there. I take the Garlic Plus with a high-quality probiotic, which we offer a couple here, the American Back Centers. A great way to avoid colds and flus and viruses. So if you'd like to try the Garlic Plus, call our office. We can send it to you for a small shipping fee. Finally, we touch on this each and every week, the Lipo Light. If you'd like a very effective and safe way to slim, shape, and tone, if you want to lose a dress size or a shirt size, if you're a male. Lipo Light triggers lipolysis in the fat cells, which causes the fatty acids to be broken down and released. Lipo Light stimulates the fibroblasts, strengthening the collagen. So if you have stretch marks, elastin fibers to tighten and tone your skin and slim, shape, and tone without any dangerous lasers. It's a light therapy that has been proven to work, and we've seen it with all of our patients that come through our door and refer other people to us. Very safe, very effective, and we have a whole protocol that goes along with it, and we can tell you about it and see if you're a good candidate for it. By calling our office, you can schedule a consultation for the LipoLite and see if LipoLite is right for you, especially as we get into the swimsuit season, as the temperature hopefully is going to get warmer here. It's a great way to get ready for your beach body. So, again, call us if you'd like some more information or if you'd like to come in for a consultation for the LipoLite. All right, so just to summarize last week, we talked about falling is taking a toll on the elderly brains. Among the U.S. adults aged 75 and older, 1 in 45 suffered from a brain injury that led to emergency room visit, hospitalization, or death in 2013. There's a 76% increase from 2007, with the primary cause being falls. We talked about regular exercise, protecting your vision health, and removing health hazards can significantly reduce your risk of falls and brain injuries because of the head trauma that can occur, and concussions, as we touched on with Sidney Crosby. We'll all see it in the news with concussions. Luckily, he's doing much better. We touched on some of the ways to take care of your vision health. We didn't get to it, but we touched on it in past episodes of BackTalk. Omega-3s, vitamin D, lutein, found in green leafy vegetables, pasteurized egg yolks, bioflavonoids, all great ways to help with your eye health. Dark-colored berries, garlic and onions, other ways to help improve your vision health naturally. Blocking blue light to protect your vision, especially at night. We talked about the LEDs at night are harmful to your eyes, so you want to try to turn them off so you're not staring at the LEDs at night. They emit this blue wavelength and lack the counterbalancing healing of near-infrared frequencies. So you want to make sure you turn off the LEDs at night, or at least use blue blocking glasses after sundown, swapping out your LEDs for clear bulb incandescence or even candlelight at night. For your computer, reducing the color temperature down to 2700 K can make a big difference as well, not just at night. And finally, how to make your home safer to avoid falls. Install safety bars, grab bars when necessary, such as around the shower bath and near toilets. Stairwells should be well lit with sturdy railings. Remove loose throw rugs and tack down all carpeting rugs. Remove clutter from your home so you're not falling on this clutter. Wear shoes or slippers with non-slip soles. Keep items used daily easily accessible. Use a stool riser seat when using the toilet. Put anti-slip mats in the bottom of your bathtub, very important, and consider a shower chair. Adjust electrical cords so they are not stretched across the floor, so you're not going to trip on them, of course. Install adequate lighting in your home. We talked about the LEDs. Avoid the use of chairs or step ladders to reach items, and use a grasping tool if necessary. You've seen that little grabber that people have. My mother has one when she's had 2 artificial hips and a knee because she has rheumatoid arthritis. Great little grabber tool to help you pick things up so you don't have to bend over and possibly fall when you're picking up these items. All right, we're going to switch over. And if you'd like a copy of that article, of course, visit our Facebook page, American Back Centers Pittsburgh. Look at last week, and you can print that right off of last week's posting. This week, we posted, What Does Sugar Do for Your Brain? Of course, go to American Back Centers Pittsburgh and print this off. If you'd like a copy of the article, this is from McCullough.com. Remember to like our Facebook page if you get a chance when you go to visit American Back Centers Pittsburgh as well. We greatly appreciate that. So what does sugar do to your brain? Story at a glance, a summary. The overconsumption of sugar is increasingly being linked to brain-related health issues, such as depression, learning disabilities, Alzheimer's, memory problems, and overeating. Research suggests overconsumption of sugar and sweets can trigger reward and craving states in your brain similar to addictive drugs. Not all sugars have the identical effects. Fructose, though, has been shown to activate brain pathways that increase your interest in food, whereas glucose triggers your brain's satiation signal. So this is from Dr. McCoy. He goes on to state, while all cells in your body can use glucose for energy, when you burn fat as your primary fuel, your liver produces ketones that burn fat cleaner in that they generate fewer oxygen species, reactive oxygen species, or ROS, and secondary free radicals than sugars. The conventional view is that you need sugar or glucose to satisfy your energy needs, but only a very small amount of sugar is actually required because sugar represents calories. Excess consumption will, of course, negatively affect your health. If you haven't given much thought to how much sugar you consume and what you've been doing to your health, now is the time to get educated. Overconsumption of sugar, of course, is increasingly being linked to brain-related health issues such as Alzheimer's, depression, learning disorders, memory problems, and overeating. Your body recognizes sugar as a drug. Writing in the Atlantic publication, Dr. Robert Lustig, a professor of pediatrics at the University of California, San Francisco, states, the U.S. war on drugs has taken a back seat, but not because it's been won. Rather, because a different war has cluttered the headlines, the war on obesity, and a substance even more insidious, I would argue, has supplanted cocaine and heroin. The object of the current affliction is sugar. Who could have imagined something so innocent, so delicious, so irresistible could propel America toward a, quote, medical collapse? Previous research involving humans and laboratory rats suggests consumption of sugar and sweets can trigger reward and craving states in your brain similar to addictive drugs. Not only can sugar and sweets substitute for drugs like cocaine in terms of how your brain reacts to them, they can even be more rewarding. Dramatic effects of sugar on your brain may explain why you have difficulty controlling your consumption of sugary foods when continuously exposed to them. Another study suggests a high degree of overlap exists between the brain regions involved in processing natural rewards, such as sugars and sweets and drugs of abuse. As we skip on down, the biology of the brain and how bad habits like sugar addiction take the root. An article published in CNN Health reminds us of the connection between your nucleus and the prefrontal cortex drives the intentional actions, such as deciding whether you take another bite of chocolate cake, for example. The prefrontal cortex also activates hormones like dopamine, triggering thoughts such as, quote, hey, this cake is really good. And you're going to remember that in the future. Lustig explains that the biological process that takes place when you consume sugar or any addictive substance. The brain's pleasure can't talk today, sorry, Center, called the nucleus, is essential for our survival as a species. Turn off that pleasure, and you turn off the will to live. But long-term stimulation of the pleasure center drives the process of addiction. When you consume sugar, your nucleus receives a dopamine signal from which you experience pleasure. And so you consume more. The problem is, with prolonged exposure, the signal gets weaker. So you have to consume more to get the same effect, which is tolerance. As you pull back on a substance, you go into withdrawal. Tolerance and withdrawal constitute addiction. And make no mistake, sugar is extremely addictive. As we skip on down, they go on and show some brain imaging showing food addiction is real. Some real good brain imaging with MRIs showing that 12 overweight and obese men between the ages of 18 and 35 consumed a high GI and one GI meal. The imaging differences are dramatic, showing big differences with scans with a high GI meal and showing how the effect it is on your brain. And it's truly remarkable. Next paragraph, can too much sugar contribute to Alzheimer's disease? While insulin is usually associated with its role in keeping the blood sugar level in a healthy range, it can also play a role in brain signaling. In one animal study, when researchers disrupted the proper signaling of insulin in the brain, they were able to induce many of the characteristic brain changes seen in Alzheimer's disease, including confusion, disorientation, and inability to learn and remember. It's also increasingly becoming clear that the same biological pathway or pathological process that leads to insulin and lipid resistance, as well as type 2 diabetes, may also hold true for your brain. And that's why they're actually calling it a hypothetical type 3 diabetes now. When you eat too much sugar, this, quote, type 3 diabetes, which is not a real term as of yet, can actually affect your brain and contribute to Alzheimer's disease. So he goes on to talk more and more about how glucose and fructose can affect your brain in a very negative way. Fructose packs on pounds faster than any other nutrient. We see it commonly in energy drinks, fruit juices, sodas, sport drinks, as well as countless other sweetened beverages containing high fructose corn syrup. Like all fructose, high fructose corn syrup is metabolized as body fat far more rapidly than any other sugar. Similar to alcohol, the entire burden of metabolizing fructose falls to the liver. So you're putting as much stress on the liver, more or less, if you were to drink a beer as you would if you drink Gatorade, believe it or not, or fruit juices, soda, or sports drinks loaded with high fructose corn syrup, or just fructose in general. High amounts of fructose can lead to arthritis, cancer, gout, heart disease, insulin resistance. We talked about that, even with the brain and Alzheimer's now. Your, quote, type 3 diabetes, type 2 diabetes, metabolic syndrome, obesity, elevated blood pressure, elevated bad cholesterol, LDL, high lipid levels, high uric acid levels, liver disease, especially in non-alcoholic fatty liver disease. And we can see why, because it's putting a tremendous stress on the liver, very much like alcohol. So if you're drinking a Gatorade or a fruit juice every day, sports drinks every day, some would say, I hate to say it, it's almost like an alcoholic, the stress on the liver, because you're putting tremendous stress on the liver and strain. A lot of people don't know that. So some of the recommendations to limit your sugar consumption: increase your consumption of healthy fats, omega-3s, saturated and monounsaturated fats, free-range eggs, coconut oil, avocados, we touched on many, many times, organic butter from raw milk, macadamia nuts, pecans, virgin olive oil, wild Alaskan salmon. Drink pure, clean water instead of sugary beverages like fruit juice and soda. Go a long way to improve your health. The best way to gauge your water intake, again, is to observe the color of your urine. It should be light pale yellow. And the frequency of your bathroom visits should be around 7 to 8 times per day. Add fermented foods to your meals. Beneficial bacteria, as we all touch on the show all the time, and fermented foods will aid your digestion and proper detoxification. Kefir from grass-fed milk, as well as organic and natto yogurt from raw grass-fed milk, as well as fermented vegetables. So these are some great ways to help you avoid the corn syrup, the sugar. We touch on these things, and it's really remarkable. A lot of people don't realize it affects your liver just like alcohol does. And we touched on how there's now a correlation, this hypothetical type 3 diabetes, correlation to your brain, a link to possible Alzheimer's, memory issues, learning disorders, even in kids, too much sugar, memory problems, overeating, obesity. So why do this? And again, don't get hooked on it because you can see how addictive it is. The dopamine centers signal this, and very addictive and very difficult to overcome. So once you get into the sugar and you're eating a Reese's peanut butter cup every day, you're eating the sugary drinks every day, it's hard to kick it because your body wants it and needs it. Very similar, I hate to say it, to a heroin addict or a drug addict. It's very difficult because the addiction that occurs. So don't get caught up in this. And make sure you're following those recommendations Dr. McCool gave you. He touched on the omega-3s, fermented foods, drinking pure water, trying to do these things to avoid being addicted to sugar so you're not ending up harming the body, and as we specifically talked about today, the brain as well. All right, so if you'd like a copy of these articles, again, we're trying to post them all on our Facebook page, American Back Centers Pittsburgh. Just go to American Back Centers Pittsburgh. If you get a second, like our Facebook page, and you can print off anything that we'll be touching on BackTalk the next few weeks right on our Facebook page, again, American Back Centers Pittsburgh. All right, we are short on time, so we're going to give you some final closing thoughts. Remember, do your homework before pursuing any treatment option. Ask for the research. There's many scams out there. There's many treatments out there that claim to be similar to VaxD. With VaxD, you have a proven track record, a time-tested treatment, very well-researched treatment used worldwide at over 300 facilities. 3,000 patients a day are currently being treated with VaxD therapy. It's accepted by all fields of healthcare, and most importantly, it's something that actually works. With VaxD, the results speak for themselves, whether you have a herniated disc, bulging disc, sciatica, stenosis, failed back surgery. We also have treatments for failed neck surgery as well. Give us a call. Schedule your consultation today. We may be able to help you. We've helped, without exaggeration, thousands of patients over the 20 years of doing VaxD therapy. I want to thank everyone for listening today. We'll be on next Wednesday and every Wednesday with another episode of BackTalk. This is Dr. Peter Pedduzi. Have a good week. Bye-bye.
You've been listening to BackTalk with Dr. Peter Pedduzi, sponsored by American Back Center, 103 Bradford Road, Building 2, Suite 100 in Wexford. For more information or to contact Dr. Pedduzi for an appointment, call 724-935-3300 or toll free 888-222-8293. That's 888-222-8293. And join us again for BackTalk with Dr. Peter Pedduzi.
At American Back Centers, you've got nothing to lose but the pain.